Hello everyone, I am Dr. Bhagyashri, pursuing my final year post graduation in MD Radio Diagnosis at Bangalore. My mother and my husband have been working as physician and anesthetist at District Hospital Yadgiri, and they've been serving in COVID for the last 2 to 3 months. And according to whatever calls they are getting from different patients since last 2 to 3 months, there are a lot of confusions, a lot of very small misconceptions about COVID and COVID vaccine. So this video is done with the purpose of clearing all those little doubts.
See, what you're seeing here is the trachea, that is the airway. The air that you breathe in enters your lung through this path, and these are your two lungs, which are normal lungs. If you want to look a little in depth, so this is the trachea, and the trachea will divide into the multiple smaller airways. Okay, this is the way through which your air travels to reach the most peripheral part of your lung, which has some structures called as alveoli. So these are the structures, that is, this is the end point of your air what you breathe in. These are balloon like structures and they are very flexible. See, they are just like balloons, meaning when you take air inside they bloat up, and when you expire, that is when you give out the air, they collapse like this. That is during inspiration as well as expiration. So whatever air you're taking in, see here, the air that you breathe in is coming inside, and whatever the red structures you're seeing are your blood vessels. That is, the oxygen from the alveoli enters your blood vessels, and that is what we measure, that is called as saturation. SpO2, what we all said all these days, that is nothing but oxygen levels in your blood, that is saturation. Normally it should be above 95 or above that. So in case of pneumonia, that is what is basically pneumonia. So this is a normal alveoli which has air inside it. So if this alveoli is filled by water or pus, then that is called as pneumonia. So what happens, because pus is present inside, is the oxygen that is coming inside like this, it has no space to enter the blood vessels. Hence the oxygen levels in your blood will fall down. So that is when we call the saturation has fallen down. Now these are the patches of pus or water what I just showed. These are the abnormal lungs, that is pneumonia lungs. Now there is a big fuss about should X-ray be done or CT be done, and what exactly is X-ray and CT. So whenever we take photo, a selfie probably, then that's called as photography. But instead of the camera that we use, if we send in the X-rays to study a particular part of the body, that is called as radiography, and the normal man calls it as X-ray. So these are the normal lungs. So when you send X-rays through these lungs, you get something called normal chest radiography or normal chest X-ray. Here the black color just indicates that the lung is filled of air and there is no pus or fluid in it. So when you send X-rays through these abnormal lungs, you see something called white patches in this X-ray, that is indicative of pus or water which is present inside the lung. So if you send X-rays from one direction, you get X-ray. If you send X-ray from multiple directions like this, from all the 360-degree, then you get a video of the chest, that is called as CT or computed tomography. So what exactly is CT score? All these days there was a lot of fuss about CT score. The maximum score that is given is 25. So if I say that supposing this entire lung is involved in pneumonia, then we say that the score is 50% of 25, that is 12. The CT score is given to quantify the percentage of lung which is involved in pneumonia. Why CT should not be done in all the cases? That is, the mild cases may not require CT. The people, soon after they get tested as positive, COVID positive, they are very fond of getting CT done. But just remember, radiation has its own side effects on the eye, thyroid, lungs and every part of your body. So CT has approximately 300 to 350 times more radiation than a normal X-ray. So please do not get CT done unless advised by physician or unless the SpO2, the saturation, falls below 94. So there's a big confusion about what is mild, moderate and severe disease. So whenever your infection is limited to the throat, or it has entered into the lung but not yet caused severe destruction, that is, saturation is maintained above 94%, that's called as mild disease. The saturation falls from 90 to 93, that's called moderate, and below 90% is called as severe. So the moderate and severe might require admission. What exactly is vaccine? Many people have a notion that taking vaccine will produce infertility or may produce the actual COVID infection. And many people have a wrong notion that the vaccine itself contains live viruses. So let's just look into the basics of what is a vaccine. So whenever you get cold, normal cold, within 5 to 7 days we have observed that even without taking proper medication, for many of us the cold has already resolved. Supposing this is the virus particle, it enters into your lungs, that is in the throat, it gets stuck to your throat surface, and it enters your body. As soon as it enters, your body's immune system will respond back to it by producing something called as antibodies. Within a span of 5 to 7 days, your antibodies are so produced in very high quantities, such high quantities that it will sit on the virus and destroy it, and then your cold will disappear. So supposing this is a COVID virus, this is the RNA content within that. So once the virus enters the body, it multiplies into millions of them. Why I have put star is the remdesivir injection, which was such a big revolution all these days. This is its site of action, that is, it prevents virus from multiplying into many. So these vaccines contain a part of dead virus, not even the complete virus, they contain only a part of the dead virus, so that whenever this vaccine enters your body, that is whenever you take vaccine, your body gets fooled that it thinks that the actual virus has come, and it starts producing multiple antibodies. So this vaccine is given in 2 doses, that is priming as well as booster dose, with a span of 6 to 8 weeks. By taking the dead virus twice, you're fooling your body to produce multiple antibodies, so that when the actual virus has entered your body, there is no need to panic. That is, your antibodies will kill the live actual COVID virus, and it won't let the virus have severe effects on your body.
Once your saturation drops below 95, that is 94 or less than that, please seek medical attention. That is, you need to go to a hospital and get a medical advice. That's the first thing. And if you are a mild case, you have to take medications, but you can still be under home isolation. The next doubt everybody has is, once after completing the home isolation, when should you mingle back with your family members? And supposing people who are discharged already from COVID hospitals, what if they spread infection to the house members? That is a bigger doubt which is present in people's minds. The thing is, you will be infected only for 9 to 10 days after you become symptomatic. That is the first thing. That is, after 10th day of your symptoms, you will not be infected. You cannot spread infection very easily to your neighbors or your house members. So wearing a mask and staying in the same house will also be good enough. I hope this video has helped you in clarifying maximum concepts about COVID. One more request is, please do take vaccine. There are no side effects unless there are real contraindications as advised by your physicians. Please do not avoid vaccine. Please take both doses of vaccine. That's the first take home message. And the second thing is, please get a CT done only if it's advised and if it's really required, because you have to keep the side effects of radiation also in your mind. And I hope this has helped you all. Thank you.